Dr. Rina, welcome to my first podcast. I'm so excited to have you as a guest.
Thank you. It's great to be here.
Lovely. If you could just introduce yourself to the audience, like what your line of work is.
Yeah, sure. So I'm a counselling psychologist. I run my own private practice. So I do a range of different things. I offer one-to-one therapy, couples therapy, but I also work with organizations and deliver workshops and training around mental health and just different types of consultation around well-being and mental health. I also contribute to the media as well, just in terms of various aspects of relationships and well-being. And I'm hopefully going to be an author very soon.
Wonderful. About author, that's one of the reasons I really wanted you on the podcast, because I know you've got a book coming out in April, I think it is, about self-care, self-love in terms of relationships with yourself. Could you tell me a bit more about the book and why you wanted to write the book?
Yeah, so the book is called The Magic in Me, and it's a 30-day self-empowerment guide. And I call it a self-empowerment guide rather than a self-help guide, because I think we need to be focusing on the relationship with ourselves. And I'm a firm believer that the relationship that we have with ourselves kind of sets the tone for our experiences in other relationships, and also what we view ourselves to be capable of or not, maybe the opportunities that we go for, how we feel about ourselves, the way that we think, the actions that we take. The relationship with yourself is the most important thing. And throughout therapy, that's something that I've seen time and time again. Everyone has their pain points, everyone has that part of themselves that they want to work through and just kind of better. So for me, it's like having a psychologist in your pocket. Some of the activities that I might use with people in therapy, but the key thing is to just sort of understand who you are in the now, maybe what's working for you, what needs to change. And the aim is to sort of drive people towards more of an authentic connection with themselves. So it's not about perfection. It's not about, never feeling anything, but it's really about tolerating emotions, understanding yourself, and building better connections overall.
Brilliant. Thank you for that explanation. In terms of self-care, you talk about sort of tools, and I know you're a therapist. We've talked before about breaking the taboo in terms of getting help or therapy. How do we oh, sorry, lost me then, but I'm back. Is it a cultural thing, do you think, therapy, or do you find that in all cultures there's a taboo around seeking help, getting therapy?
Yeah, I think you cut out a little bit there, but in terms of how we sort of break the taboo, I think we first need to recognize that it's there. The stigma can still be there, even if we don't fully believe it. It's what we internalize that can sometimes stop us from getting support because of shame or a fear of exposure. So I think one way that we start to challenge that is by having discussions like this. So, whether we use our social media platforms or podcasts, or whether we write books or whatever we do to raise awareness, the key thing is to keep talking. And, if we can just inspire one person to connect with themselves, I think that's really important. Therapy, I think there is a shift in therapy. One of the things that I've been noticing, which I think is great, is since the pandemic, I think there's a lot more empathy around understanding that times can be challenging and we all have different emotions, and sometimes we cope better than other times. And I think a lot more people are seeing therapy as being something that's proactive rather than waiting for a point where they're at crisis. And that probably was a bit of the mindset pre-pandemic, that you wait till you're at crisis point and then you need to see someone. So there's a real sort of shame around having to see a professional, for example. But now I think people are viewing it more like they might view their physical health or their holistic health. Our mental health is a really big part of that, and people are realizing the link between how they feel emotionally and how they feel physically. That's really encouraging for me. Like, some of these discussions just bring certain emotions to the forefront. It gives people an opportunity and a voice, and actually it's really important for people to see other individuals that they might identify with, or go, do you know what, that I can understand that emotion even if I don't understand that story. So that's my hope, is that potentially people use therapy as more of a self-development tool and a space to just understand themselves so they can cope better on a day-to-day basis.
I like that idea you talk about, being really proactive with therapy. So I, for example, have therapy booked in every month. For the next 6 months, I'm booked in. And when I talk to people and they say like, how are you so like together? Or, like they sort of say that. And I say, oh, well, I go for therapy. But they're like, you don't look like someone that needs it. So it's that stigma, isn't it? About you don't
Yeah,
just go when you're at rock bottom. It's something like if you go to the gym, it's about your self-care and your self-development. But I think, like you say, the more we talk about therapy being just this normal place that we go, you go and get your nails done, you go to the salon, like this is something for like the whole mind, body and soul. And I think for
yeah,
me, therapy, I think it's been great, is just having like an unbiased opinion from somebody. They've got
yeah,
no agenda. And then they give you the tools afterwards. So my therapist is great, and she will give me some tools for the next one. So it's not
yeah,
just about just a chat. It's like, right, you're going to do this for the next time we meet. So it's about that development cycle, which I think people don't really see as a therapy session.
yeah,
But do you think? I mean, the more I talk about therapy to people of my generation, the more I hear they're all going, which I think is a really, really great story. So
yeah.
how do we shift the therapy in terms of our parents? Because I know people that are going and not telling their parents they're going because of the stigma. What would
Yeah.
you say to someone who is doing that? Like, how do we break that?
I think it depends, Resham, on how safe it feels. So, sometimes a reason why you might be going to therapy is because of intergenerational issues, or maybe trauma, or what you might have witnessed in terms of relationships or coping mechanisms that have been passed down. So I think kind of whether you choose to share whether you go to therapy or not is a very personal thing, and a consideration is safety. But I think even things like social media, maybe sharing articles with your parents, or even if you're watching sort of the TV, you might have a discussion around things that you're seeing. So I think thinking about how you can make mental health a part of everyday discussion is important. And sometimes it includes taking a little bit of a risk to sort of model that. So, there might be ways in, like, for example, if someone does yoga, you could start talking about breathing techniques and relaxation, or managing stress. So thinking about the words that you use, that might be a little bit more accessible. I know the terms like mental health are going to bring up different things for different people, and that's okay. So thinking about language, thinking about what you model, thinking about how you talk about your mental health. And I think we have to respect that not everyone's going to be in the same place. So they might not want to talk about their own experiences, but you could be an inspiration just by how you model staying calm, or how you model talking about your own well-being, or sharing some of the things that you do to manage stress. So there's little ways that we can kind of chip away at some of the stigma. And I think how we explain mental health, so it's a part of our overall well-being. So perhaps with people from different generations, they might focus more on their physical health, and that's where you can start the discussion of making a connection between the body and feelings. Because I think there's probably a lot of trauma as well from our previous generations. And I think everyone copes in the best way that they know how to. And, sometimes our parents' generation might not have the coping mechanisms that we have. They might not have, yeah, they might still be in survival mode a little bit. So I think a part of it is how we compassionately support them to shift and change and mold. And probably a lot of that will be around the next generations, and how we build on talking about emotions. All of that might be really new in terms of concepts for other generations sort of prior to us.
I totally agree. I think there's a lot of work to be done with the whole generation and the stigma and how we do that. So, in terms of the different generations, I know that something that came out of one of my therapy sessions was sort of self-care was, saying no and setting boundaries. I know a
Mm.
lot of people on that sort of journey have a lot of guilt when they do that. Do you touch on that in your book in terms of self-care and sort of setting those boundaries?
Yeah, I do, because I think we internalize lots of beliefs around the world about ourselves, about our shoulds, our musts. our have tos, our ought tos. Some of them are our own beliefs, and some are the beliefs of our culture or wider society or the media. So all of these influences that we are consciously and unconsciously taking on. But our beliefs are the things that really drive our sense of self. And that kind of drives our interaction in the world and also our relationships in terms of, self love, self care, self compassion. So, limiting beliefs is definitely something that I touch upon. And even if we know on a logical level that they're not true, it can feel very different on an emotional level. So even though you probably know logically that saying no doesn't mean you're the worst person in the world, what you're really unlearning is kind of the emotional side of that. And that takes courage, it takes practice, it takes an understanding of maybe why that's triggering. So we would have heard lots of shoulds throughout our lives. And that's what we're like a sponge when we're growing up. We kind of absorb all of that. That becomes our blueprint for life. So, yeah, I think a part of the book is sort of the unlearning to relearn. And when we think of self care, when we think of self love, it's a tough process to actually sit with yourself and reflect. I say like awareness is like a light bulb. When you switch it on, you can't switch it off again. But sometimes you do want the dimmer switch to turn it down a little bit because it's uncomfortable. It's uncomfortable kind of exploring some of the things that are going on inside of us. But when we can kind of start to master that and sit with it, it's really empowering, because then we sort of pick healthier relationships. We talk to ourselves in a kinder way. We also realize what is in our control and what's not. And sometimes that's really sad and there's lots of loss there, but it also gives us a chance to take control of the things that we can. So where can we say no? How can we do that safely? If we are engaged in lots of family dynamics, where are we also taking time out for ourselves? So it's a balancing act, I think, a lot of the time.
Absolutely. I love the way you sort of use the light bulb analogy of like once you spread the awareness, the light bulb is on. So I have a lot of people I know who are starting to, say the no, can't do this or I can't do that for whatever reason. I think especially is prevalent when they've had kids because they now need to prioritize their own family network. What would you say to one of those people listening that they're doing so much work on themselves and then they just each family member they might be talking to are getting a different reaction to the I can't do this or the no. I do worry for people I know that will go back to the old ways. So what tip would you give someone listening that is on that journey but is really struggling with family members? Because we don't want
Yeah.
to say just cut them off, but are there any tips that you could give somebody listening, especially those I know?
Yeah.
I've got a lot of friends with just children. And they're trying not to run around everyone else. They're trying to keep people to understand their routine. Are there any sort of ways of saying something they could take away from today?
Yes, I think the pull will always be to go back to old patterns, right? So if you think about our relationships, you could think about like a figure of eight or an infinity sort of sign. We loop in to patterns and then people loop in with us. So there's an expectation. There's an expectation of this is just how we do it. So perhaps in those relationships, there's been a difference in the power balance or the expectations of someone. So I say start small, where you can say no or where you can balance that with time out for yourself. I think that's really important. I think, sometimes it's a process of negotiation, not right now, or give me some time to think about it, or I'll let you know. So you can kind of buy yourself some time, because what happens when we're in relationships where there's expectations is we can become quite reactive and just go back into old patterns. So the key thing there is to almost buy yourself a little bit of space, emotional space, time, to then be able to respond rather than react. Because if we're fearful, and that also includes like the emotional fear, not just physical fear, we're more likely to go into fight or flight, and we're more likely to be reactive. So take time out to even regularly ground yourself, whether it's taking a quick breath or like noticing what you can see, or going for a walk. So just, buy yourself some time in terms of the grounding. And if you can, even with kids, just top up during the day 30 seconds to take a breath, 10 seconds to just jot down a little bit around how you're feeling. And in that way, you're also modeling some really positive grounding techniques for your children as well. But chip away at it slowly. And, I say there's like two people or two types of people. There's the radiators and the people that kind of light you up and energize you. And then there's sort of the drains, so people that kind of suck your energy. And I think what you want to be doing is exploring the key people around you and just making sure that even if you have some drains, you've got some radiators around you too. So you're balancing the time between the both. And if you don't have people who are radiators, think about activities or things that you do that light you up. And that's what you want to be focusing on, because we all have what I call like an emotional bank balance. Yeah, you can only give out so much before you go into your overdraft, and then you go into the red, and then you're in real trouble. So topping up is super important, whether it's through healthy relationships or activities or things that make you feel good about yourself or feel safe or energized. So that's what you're constantly checking in on, like, what is my emotional bank balance? How much can I give right now? When might I need to say no, so I can actually then be more present for people that I need to be present for. So it's really kind of about fine tuning that, and it's a process, and it's hard at times, but small steps lead to bigger changes over time.
Love that. The small baby steps, isn't it? And I like the sort of
Mm,
radiators analogy. It's brilliant. Because there's like, especially when it's coming to family members, they're always going to be there, and it's recognizing who are everyone's energy, isn't it? So you talk
yeah.
about a lot about self-care and relationships. You're doing therapy for lots of well-known people. You're in magazines. How do you look after your self-care when you're in so much
Yeah,
demand?
it can be challenging, and there's days even where I'm like, oh, this is really exhausting. So for me, I do have certain boundaries around my time. So, for example, I never work weekends, and that's always been a rule for me. I think about who's in my social support network. I actually start the beginning of my day and end my day in the same way. So I start my day by journaling, doing a gratitude list, and doing a little bit of a visualization, because I find that helps my mind. And then I end my day in the same way. So getting into a sleep routine. So I'll light a candle. That's just something I do. Once again, I'll do my gratitude and I'll do a visualization. So for me, I know that whatever comes in the day, I have a stability in terms of the beginning and the end of my day, which is really important. I think about the space that I'm in. I think about, who's in my safe support network. There's times when I have to literally say to people, I can't talk anymore. I can't speak right now. Give me 10 minutes, or I'll call you back, or I'll speak to you tomorrow. And, people will understand that if they're kind of supportive. So I think being more proactive in terms of my communication is been useful. And then I try and counterbalance sort of some of the emotional work with like physical stuff. So for me, like, I like to box, or I like to maybe go to the gym as a way to release some of the emotion. So every week I try and do like one thing for my body, one thing for my mind, and maybe one thing for my personal development, which doesn't have to be sort of psychology related. And I think just having people around you who know you for you is also important. So, I'm not a psychologist all of the time. Sometimes you just want to be yourself and be vulnerable. So, really having people who you can be vulnerable with. And then in terms of work, I make sure I've got the right structures around me. So, I have to have a clinical supervisor where I can talk about my cases. I sometimes go for personal therapy as well. So, it's a continuous journey, and sometimes the balance is easier than other times. But yeah, just noticing where I can put in some boundaries and consistency is important.
Oh, wonderful. So tomorrow is Valentine's Day.
Yeah.
So today's the 13th of Feb and tomorrow's the 14th of Feb. So you are doing a talk with the One Club.
Yeah, that's
Um,
right. Yeah.
so I hear they're an amazing group of people. So what made you join that club, and what's your purpose there?
So what I love about the club, so I'm involved in lots of different networking, and I don't work for them. I've just kind of engaged with them. But what I like is that it's full of entrepreneurs and actually people who are thinking about giving back. So the kind of ethical element is really important. So it's not just people who are successful or have a lot of money. I think their aim is to really redefine what that 1% looks like. And a key thing is about how you network, but also give back. So the kind of ethical element was really important. That's why you'll see that they do lots of talks, and it's about sharing knowledge and linking in with like-minded people. I love the creativity of it. So often when you get into other networking groups, it feels a little bit elitist. So either you're in or you're out, or it's all about how much money you can make. And I think money is an important consideration, but values I think are also even important. That's more important for me personally. So that's kind of what I aligned with. And just the opportunity to sort of be in the same room as successful people. But what I love is that also with the success, people talk about their challenges, and we don't hear that often enough. Often we can think that success is linear and things come easily to other people, but not to us. So really hearing people's struggles and people's stories just helps to normalize a lot of kind of what you can go through, particularly as sort of a business owner. So, I feel like I knew the therapy side, but the business side is something I've had to learn over the last sort of few years. And it can feel quite isolating. So, having people that you can link in with who understand the journey and understand some of the processes and the struggles, even if it's a different profession, I think that's really important too for me personally.
Absolutely. So you're not only you sort of setting up your own business and you're then writing a book at the same time. How long did that take you?
So the book, I actually had the draft. I've always wanted to write a book since I was a child. It's been like one of my personal goals. But I probably had the draft like around 2020, so during lockdown. I started to streamline it, and it was just a concept that was there. And I think one of my things over the last year or so has been to sort of take more risks. And I didn't have a clue. I was like, I don't know how to get this published, what are the processes. It's all pretty new to me. And then I just decided to sort of take the risk this year. And it does feel quite exposing because it's something that, I've worked on, and it's easy when it's a concept. When you have to put it out there, it's quite scary. But yeah, so I managed to find a publisher through a recommendation, and yeah, decided to go with a publisher for my first book just because I want to understand the process, and that's the way that I learn best. So yeah, it's been around for a couple of years, and then like in the last sort of 6 months, I've really just gone back to it, updated it. And also in therapy, I'm paying attention to where the same themes are arising again and again. And a lot of it comes back down to the way that we view ourselves. So whether you're super successful, a millionaire or a billionaire, or whether your identity is linked in with one part of your life, like being a mom, or whether you're a business owner, or whether you're juggling many hats, whether, whoever you are, the way that you perceive yourself is going to have a big influence on what you then sort of attract to you.
Love that. On your social media, you talked about you're sort of growing by learning how to write a book. This is at your comfort zone. I know in some of your social media, you've got sort of like growth mindset and fixed mindset. Do you have any clients
Hmm.
that come to you and they're just so in their fixed mindset, and you're just like, there's actually nothing I can do with this? Do you have to actually have that conversation with someone, or has that never actually happened?
No, it can happen. So I always do an assessment with people just to think about, why is it that they want therapy? What are their expectations of therapy? Why now? And, I see myself as someone that brings expertise to the space, but I'm not an expert on someone's life. So therapy is a collaboration as well. And, people have to be ready to sit with some of the challenges and some of the emotions that can come up. So I'm always kind of assessing whether that's the case. And, for some people, they might want just something structured, a few strategies, maybe 3 or 4 sessions. For other people, it might be around that personal development. So the therapy will kind of be tailored to what that individual needs. But there are times where, I might need to gently challenge and notice the resistance or notice the defenses and just try and explore what that's about. I'm not here to make anyone do anything. It's always a personal choice. And I think people will engage in the way that they know how to, and in a way that feels feel safe, and they'll do what they feel ready for in that moment. And therapy is one of those things that you can always come back to it at a later date. Or you might dip in and out, or it's an evolving process. So yeah, there are times where you might have to explore, is it the right thing right now? Or why are they maybe not implementing things that you've discussed together? Or what impact is that fixed mindset having on their life? And actually, is it at a point where they want to change things? So yeah, therapy is more, it's not as passive as some people think it is. And that's some of the things that I want to sort of challenge, even through my social media, that a therapist isn't just someone that sits there and listens and goes, yeah, okay, interesting. It's a very active process. It takes a lot, it takes a lot of energy to show up for therapy. And sometimes I say to my clients, you might feel like you've run a mental marathon in the last 50 minutes. And you get sessions like that where, there's a lot, particularly when we look at trauma and past relationships, there can be a lot that comes up for people. And, so thinking about self-care around that too.
Brilliant, thank you. So if someone's listening to this and
Yeah.
they want to get therapy, and they don't know how, what tip can we give them today about getting help?
Yeah, so there's different types of reasons why people might want therapy. So I think just understanding sort of the why. The key thing, probably the first thing you might want to consider, is whether you can speak to your GP. So your GP can then make a referral to a local community service, or they might make recommendations. So that's one avenue. The second, if you've got private healthcare, that might be another route. It's where checking your policy to see if that covers mental health. You can also check with your employers to see if there's an employee assistance program, because they'll be able to then do a telephone consultation with you and then refer you to the right kinds of support. So that's another option for people. So all of those options are, you don't have to fund that. They're kind of free support services. You might even look at your local authority website just to see what local organisations and charities offer therapy as well. There might be a waiting list for some of those, services, so just bear that in mind. If you are concerned about someone's presentation or your own to a point where you're worried that they might be unsafe or in immediate danger, then it's worth calling either 111, taking them to A&E. But there are also helpline numbers that are available. So the Samaritans is there 24 hours a day. It's confidential. If you're a young person, the Mix, if you're under 25, is available. You've got Childline if it's a younger person. But you've also got other helplines like the Calm helpline, Sane, Mind. So there are helpline numbers available, but Samaritans is 24 hours a day. If you're able to self-fund, then what you can also do is either look at websites like the Health Professionals Council, where you've got a range of different professionals, or other main governing bodies, so like the British Psychological Society, if you're looking for a psychologist, or even the British Association of Counselling and Psychotherapy, the BACP. You'll be able to sort of search for individuals within your area or who have the expertise that you're looking for. But that would be more sort of self-funded. Whoever you go for, you just want to check their credentials. You want to check, where did they study? What did they do? And you can ask therapists these questions when you speak to them. Just like they might be assessing you can assess them too, because the key thing is about finding the right fit. The key thing is about the connection. So you want to find out where they trained, how many therapy hours they have, what support they have in place for themselves, like supervision, because some titles in the UK are not regulated. So, for example, counsellor is not a regulated title. So you could have done a 6-week counselling course and call yourself a counsellor. So you just want to be careful around those types of things. Whereas other titles like counselor psychologist is regulated. People have gone through the same process to get that title. So just be aware of that. So ask questions, ask about their approach, because everyone will have different approaches. If you don't understand the types of therapy, ask the therapist or the counsellor to explain it to you. And that will help you to make your decision. And I say to people, especially if you're looking at private therapy, talk to a few people and just see how you feel, because that gut instinct is also important. And people shouldn't be making you sign up for lots of sessions. Go for an assessment session, and then you can still decide how that feels.
Wow, lots of resources. Thank you. And I think that's something really important for someone who's listening and wants to start this. They have control, like how many sessions do they want? It's a collaborative approach, and there's so many options. So, you can try different things until you find something. So it's not going to be your first session. You're going to find the right connection. So that is amazing. Thank you so much. Going back to your book, if people
Yeah.
want to buy it in April, is it April it's coming out? Is that when you're launching
April,
it?
yeah. Hopefully the end of April, around the 27th. Yeah.
Wonderful. And how can they buy it? Is it on Amazon? Where are you going to sell it in
Yeah, we'll
bookshops?
be on kind of with major retailers. I'll probably have something on my website. So if they want to kind of have a look at my website, you should be able to buy it through there as well. So it should be in shops, it should be on Amazon. But yeah, stay tuned. If you connect with me or if you send me an email, I'll be able to let you know when it's coming out and how you can buy it as well.
Wonderful. So remind everyone of the title of the book. Was it Magic Mind?
No, it's called The Magic in Me. So it's a
The
30-day
Magic in Me.
self-empowerment book. So the first, 11 days focus on the relationships that you have outside of yourself. The next 11 days is about the internal kind of relationship. And then the last 8 days is around finding your authentic self. So the first couple of bits are around the unlearning, and then the last bit is the relearning.
Love. Good luck with the book. I'll definitely be buying it and taking some of the tips and tricks from it. So we have a closing question on this podcast. So
Yeah.
the podcast is called Now I Know, because I want people to come away saying, now I know about self-care. So what one thing do you wish you knew in your younger years to help you overcome any challenges? And you wish you said, now I know about this?
Yeah, I think one thing that I would say to my younger self is that you can't be everything to everybody, and it's okay to be somebody for yourself too. So I think I was very much probably geared towards like self care is selfish, or like my role is to help others, probably like the empathic side of things. But you can't function like that all of the time. So I think, I see investing in myself as something that allows me to then be present and more fully invest in other people. So I think for me, one of the key word is probably like balance. Like it's okay to balance it out. And actually, if you say no, the whole world doesn't crumble. It's okay.
Absolutely. Thank you so much, Dr. Rina.
Thank you.
Really, really appreciate your time, and good luck with the book. And if anyone
Thank
listening
you.
is sort of, wondering about the first step for self-care and therapy, I hope they found this useful. But thank you
Thank
so
you.
much
Thanks
for
so
your
much.
time, Rina, and I'll speak to you
Thank you.
soon.
Speak to you soon. Bye.